All right, going into the hospital, gonna start seeing the inpatients that we're following. Got my supplies. Let's go. So we're starting the day off with 5 inpatients to see, basically. One that we'll see with the cornea fellow. So we'll see him around 11:30 because that's when the cornea fellow wants to come in. Otherwise, I'll go ahead and start seeing the other ones. They should be pretty quick because we're just checking mostly external things, not really having to do a dilated exam or anything. I've so far seen about 6 people. I saw 3 inpatients we were following, and I got consulted on a person with HIV off antiretrovirals with vision loss. They were concerned for CMV retinitis. So I saw that patient. And then I saw a patient with a right orbital floor and lateral wall fracture and Lafort 1 and 2 fractures. And so I went and saw them. No eye problems, basically. So they can follow up this in clinic. Normal eye exam. So try to go home briefly, and then I have to come back at 11 a.m. or 11:30 to see 2 cornea patients with the cornea fellow. And then that's all that's on the plate for right now. So fairly busy morning, but not a lot of new consults, just a couple, so not terrible. In my car now, driving home. Try to get a quick break before I have to go back. Okay, we made it home, so that's always good. See if we make it into the apartment before we get Paige back. Going back to meet up with the cornea fellow to see a couple of patients, one with a corneal ulcer and one that was admitted overnight with, I'm not exactly sure. It sounds like she may have had a corneal abrasion, but it was not clear if she had an ulcer, but it got cultured anyways. And anyways, so we're gonna see both of those with the cornea fellows and see what's going on exactly. So the cornea fellow is going to be about 20 minutes late, so I'm going to wait in the call room. This is the call room. Has a computer, a bed that's not super comfortable, but it works. And the call room's got its own little bathroom with shower, so not too bad. Not a bad place to stay and kind of wait if you have things pending. And it has our name on it, so. Okay, so we saw the 2 corneal patients with the corneal fellow. And now I got paged over to see a patient at the private hospital with seeing a white spot in his vision. So I saw him. It is 2:15 p.m. now, and I just got paged to go back to the county hospital because there's a patient there who was metal grinding and got like a small piece of metal shrapnel in the cornea. The ER doctors tried to get it out but couldn't get it out. So basically the way we get those out normally is using a needle, actually, we anesthetize the cornea so they don't fill it, and then use a bent needle to kind of dig it out of the cornea. And sometimes those metal shrapnel that get stuck in the cornea can actually leave rust in the cornea, so you get a rust ring, and those can be burred out or dug out with a needle sometimes. So I'll go look and see if I can get it out. I don't know how deep it is, but we'll see. Diamond studded burr. And it just spins like this, and it actually repolishes the cornea. And we have this little tip that looks like a little miniature propeller, and it helps kind of dig out rust rings, and it spins too. So that's the burr. All right, headed back into the parking deck at the county hospital. Okay, made it home once again. So I moved the metallic foreign body. It was very superficial, just popped it out with a 27 gauge needle. It didn't leave any rust ring or anything, so just cover with topical antibiotics. That'll all be fine. And then I saw one more patient who just happened to be next door to that patient with a subconjunctival hemorrhage. So done that. Now I'm home. All right, so I'm taking a brief nap. This is Bubbles. She's helping. Bubbles. What kind of doctor are you gonna be? So in the middle of the call, there's a severe thunderstorm and tornado watch. Going back in now, got paged for left orbital rim fracture. No ocular complaints, but they want us to evaluate. No vision complaints or anything. So we'll go see them. Normally there's nothing wrong with the eye at all. I don't think I've even seen muscle entrapment yet, which can happen where the muscle gets entrapped in a inferior orbital wall fracture, and then can restrict the eye movements. I haven't seen that yet. But sometimes these patients with trauma have like other eye problems like Komosho or hyphema or something like that. I doubt it, but we'll see. Leaving the hospital again. I saw the orbital floor fracture, no globe injury or anything. Kind of what I figured it would be. And then I saw another patient who we brought back to follow up on a hyphema, sickle cell patient. Be very careful with those. So she's doing better. Her hyphema's getting better and the pressure's doing well. So we'll keep following her daily. I'm gonna go home. All right, driving back in to replace a bandage contact lens that fell out of one of the patient's eyes when the nurse was giving drops. So we'll go put that back in. I'd rather get a new one and put it in. Okay, back again. It's about 8:20. Go put the bandage contact lens in. I'm gonna put in a bigger one so it'll be less likely to fall out. (8:46 p.m. 12,776 steps. Already walked 6.3 miles today. All right, driving back into the hospital for clinic. So last night went really well. For whatever reason, I didn't get paged in after about 9 p.m., 8:30 p.m. So that was pretty good. I slept through most of the night actually. But I walked like, I showed you my steps, but I walked like over 6.5 miles yesterday. And that was just going in and out of the hospital and walking around the hospital. I didn't go jog a 5K at the lunch hour or anything. So anyways, not bad for a Sunday night call. Now we have a full day of clinic. 70-something patients split between 3 of us or 2.5 of us, because 2 of us are out for the half day. So we'll see how that goes. But anyways, I hope you guys liked it. And that's it. Oh, and by the way, to show you my sea salt hairspray trick, where I go from this to this in about 20 seconds. Sea salt hairspray for doctor.